being vigilant is always a good idea. So because we don't want to be caught on the back foot. And we have learned that the hard way with the pandemic. Having said that, the probability of monkeypox becoming a major global threat is fairly low at this point of time. There are many reasons why this could be happening, and we need to do a deeper dive into it. And given that the reporting systems in many of the other countries may not be so great, we may actually be underestimating the true size of the spread at this point of time. But having said that, the most important thing to do is stay vigilant, look at the problem, start analyzing it scientifically, and then come up with solutions which are appropriate for it. And panic will get us nowhere. We have learned that the hard way 2 years ago. So I think it's time to be cautious, but no reason to panic. We need to understand there are reasons why this could be happening. There was a very interesting paper on this about 14 years ago, which actually speculated this possibility. And why is this happening? Remember, till about the 1970s, smallpox vaccination was universal, and therefore we probably were not seeing monkeypox. Now, the majority of the world is not vaccinated against smallpox, and therefore they have no protection against monkeypox. Also, those people who may have been vaccinated at that time may have lost their immunity by now. Also, we have a larger population with immune problems, and we also have other medical problems we're grappling with and things like that, and also skin problems and stuff like that. When you start adding all that up, our vulnerability to this starts increasing. The second part is the virus itself. Now, obviously, we need to start sequencing the virus to see if it has evolved in some way. See, monkeypox as an infection was not unknown at all. In fact, we may have been underestimating it because a lot of the problems are attributed to smallpox, and therefore monkeypox may have been buried under it. We don't have expert diagnostics in this. It's still a clinical diagnosis because this is like a neglected disease where there is not much of diagnostic or therapeutic work which has gone on so far. That is not to say that we don't have leads, but we don't have systems in place at a community level for us to do diagnostic tests. It's still a clinical diagnosis and then confirmation by laboratory by certain parameters. So obviously we need to put in SOPs in place to do all of these things. What should the general public know? Number one, there's no reason to panic. But if somebody who's returned from abroad has fever with skin changes, skin sores and things like that, then they need to contact the nearest public health agency as quickly as possible so that there is insurance that that person is taken care of, and to avoid transmission to their own family and other members of the public so that we don't set off a bigger chain in this country, which could be far more difficult to control.